Hey, it's Dr. Bill with just the tip of urology school and talking about urology's relationship with gynecology. If you are involved with a urologic oncologist who does a lot of radical work, radical cystectomies, or a urogynecologist who is trained in both subspecialties and works with vaginal prolapse repair, understand that the gynecologic organs have to be assessed, have to be addressed when your physician is dealing with this patient population. You will come across a lot of potential involvement in these organs when your urologist is working with the urologic aspect of your patient's care. Even those of us practicing general urology will come across patients with hydronephrosis secondary to cervical pathology, or breast cancer patients with retroperitoneal lymphadenopathy causing some obstructive changes in the ureter. When we look at female patients who have hematuria, at some point we will have to determine whether the blood in the urine is actually coming from vaginal bleeding and its associated endometrial issues. Understand that ovarian masses can show some abnormalities on routine ultrasounds done for general urologic issues. You will sometimes come across an assessment of an increased endometrial stripe, and you say, what the hell does that mean? And understand that in the post-menopausal patient, that will likely be significant. Those of you who are practicing in an organization that does a lot of female sexual dysfunction and overactive bladder will need to be aware of the relationship between atrophic vaginitis, endometriosis, and increased uterine fibroids. Be comfortable with pap smears and the implication of HPV testing on the male counterpart partner. Also understand that genetic testing is very big in urology over the last several years and is teed up to be even more significant in managing your patient. Understand that there's a lot of interplay between genetic markers as well as gynecologic cancers and urologic cancers. So really, it's really important to identify that there is a relationship and that it's important to have an understanding of where these divisions are blurred, have a good relationship with your gynecologic counterparts, and don't be afraid to investigate some previously thought of gynecologic literature and understanding how the interplay exists. As always, look at your AUA updates and core curriculum, and don't be afraid to broach the subject with your urologic physician mentors. They've been there before. It's Dr. Bill with just the tip of urology school and its relationship to gynecology.